It's been interesting. Many of us who go into public health, we don't go into it for the fame. We certainly don't expect to be on TV every day.
She's Governor Gretchen Whitmer's right-hand woman when it comes to COVID-19. We've been inviting her into our living rooms for months now. Dr. Jonae S. Khaldun.
When she chose you for this role, was it knowing that you were going to be alongside her with those press conferences? I know we didn't know what this was going to turn into, but did you have any inkling?
No idea. This was not, I thought I'd be behind the scenes providing public health guidance like I often am. I figured there'd be, the occasional press conference when we're announcing new initiatives. And I did, I guess, 2 or 3 press conferences with the governor before COVID-19 started. But I had no idea people would expect to see me whenever they see her when it comes to COVID-19. So it's taken some getting used to, but it's been fun.
Born and raised in Ann Arbor, Michigan, Dr. Khaldun is a wife and a mother of 3.
It's been interesting being in this role and still trying to parent at the same time. I'll tell you, my kids, they don't care. They don't watch my press conferences anymore. They're like, yeah, whatever, mommy. Yeah, you're on TV all the time. I don't care.
Right alongside the role of mom on Dr. Khaldun's resume is the title of Chief Medical Executive and Chief Deputy Director for Health for the Michigan Department of Health and Human Services. It took a lot of work and experience to get here.
I did my residency training in Brooklyn, and after that, I went to Washington, D.C., where I ended up being a fellow, worked in the Obama administration. And then after that, I was the chief medical officer in Baltimore, where I responded to opioid crisis, and we had civil unrest and potential measles scares.
Next, Dr. Khaldun returned home to Detroit at the request of Mayor Mike Duggan. It was here that she would spend years working on epidemics before being called to work on the coronavirus pandemic.
I think the thing that has been most challenging for me is that I, just like everyone else in the department and certainly the public, really just, they want data. So unfortunately, it's not as if I can just push 2 buttons and come up with some report and put it out as far as data. So it's been very challenging, I think, with the data systems and not having the staff as well. Budgets have been cut in public health for decades now. And, we now have to respond, and we don't have the staff to be able to do that as well as we'd like to.
Has it been challenging too when people don't believe the data?
I think it's our responsibility to try to get the data out, make sure it is accurate, and to communicate it in the most simple way as possible. You can't change everyone's mind necessarily, but it is our duty and our responsibility to make sure the data is out in public and appropriately interpreted as well. And that's what we strive to do in the department.
If you could say one thing to the average American family about COVID-19 right now, what would you say?
I would say that I know it's been a long year. I have 3 children as well, and they've been out of school, and we don't have childcare. We're trying to work while taking care of them and getting some type of education. And it's been hard. It's been hard not being able to do the normal things that we would do. COVID-19 is something, we don't have a vaccine or antiviral for it yet. But if you just do simple things and be patient and wear your mask and wash your hands and just do the basic social distancing, we can beat this. Our hospitals don't have to be overwhelmed. And quite frankly, we'll be able to reopen our economy even more quickly.